Financial review members wish to debate is the financial review of the Ministry of Health. All members, please turn to the Health Committee's report, and the question is that the report of the Health Committee on the 2009-10 financial review of the Ministry of Health be noted.
Mr. Chair.
Grant Robertson.
Thank you very much, Mr. Chair. It's a pleasure to participate in this debate. Mr. Chair, in the last couple of days we've had the government tell us that health and education are safe. Health and education are safe. As the slash and burn budget comes in front of the country in May, it's okay because health and education are safe. Money's going to be redirected to the health system. But the truth is, Mr. Chair, that in actual fact the health system is operating in significant deficit. Because we know that before the last budget, just for health expenditure to stand still, we needed to see an investment of $555, $600 million, just to stand still, Mr. Chair, and that investment did not come from this government. This government underinvested, $150 million underinvested. Programs in public health, programs in primary care, cut. As the district health boards, pushed by the minister to look at his manufactured targets and meet his slogans rather than the actual needs of the communities around them, getting in there and making sure that those targets and those league tables are met while primary care and public health is let go, an underinvestment, Mr. Chair. And so we'll come to this year, and I know, Mr. Chair, I can only talk a little about current operations. We'll come to this year and we're going to see a hole in the health budget of around $700 million. Now, Mr. Key and Mr. English have told us there's only 600 to 800 million for everything, for health and education. So mark my words, Mr. Chair, we will be back in this House and we will be debating a health budget that will show a cut in health spending. Because they'll say there's more money going into health, but everybody involved in the health system knows that health inflation, an ageing population, the increasing costs of actually buying equipment because GST's gone up, all of those things mean that just to stand still in the health sector, it will take $600, $700 million, and this government will not be making that investment. This government will be making cuts, Mr. Chair. Because, Mr. Chair, this government has lost its focus on the core part of the health system. As my mother would say, Mr. Chair, prevention is better than cure.
That's right.
But no, this minister's not interested in prevention. This minister is interested in looking good with his targets and his charts that say, oh, look at us, we've managed to improve elective surgery, even though the Auditor General's report, which we await with interest, Minister, even though the Auditor General's report on elective surgery might actually be telling a different story. It might actually be telling a different story about how people get their surgery. But leaving even that to one side, what we've learned from the DHBs as we've reviewed their performance, Mr. Chair, what we've learned is that those DHBs are following the money. They're following the minister's targets, and that means that public health and primary care are being cut back. Everywhere I've gone in New Zealand since I've been the health spokesperson, from Wanganui to Rotorua to Nelson, I'm told constantly it's public health, it's primary care, it's mental health where the cuts are coming. And, Mr. Chair, that is a problem for the future of New Zealand, because while the minister's priority might be to look good in the health portfolio and have a nice colourful chart, the priority for New Zealanders is getting access to quality primary care, affordable access, and that's not what's happening at the moment. That's not what's happening when it comes to after-hours care. And when I was in Rotorua, I was told by a doctor there the story of somebody ringing his clinic just after 5:30, wanting advice about whether they should bring their child in, and saying if it was going to be after hours and the cost was going to be $40, $50, they wouldn't bring their child in. And this doctor said, no, you better come in. And when they came in, they found that that child was potentially suffering from meningococcal disease. If that person, that mother, is making their decision about how, on the basis of how much it costs, rather than how sick their child is, there is something wrong in our system. And the minister actually needs to take some responsibility for what's wrong in our system, where people are paying in Queenstown $102 to take a baby to after-hours care. That is wrong. They are, Minister, that's exactly what they're doing. Where someone's being charged on the Kapiti Coast $41 to take a 20-month-old to get a cut lip repaired at 5:30, and that represents 20% of that family's grocery bill, something's wrong. And that mother, that person asked me and Mr Ryle, is what you want for me to go to the emergency department at Wellington Hospital? Is that what the Minister wants? That is a wrong priority, Mr Chair, to be sending the signal to people that primary care and public health are not what's important. And the cuts in...
Mr Speaker.